Good afternoon, everyone. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors, and thank you for joining us today. This pandemic carries a heavy cost. Businesses and their workers took a devastating hit. Families are still struggling. It is heartbreaking. Yesterday, as a healthy precaution due to increasing COVID-19 numbers, and since our neighboring counties have done so, Dr. Clayton Chow, after determining from his medical opinion, announced the closure of bars in Orange County until further notice. This was followed by a decision by Governor Newsom to close a number of business sectors in 19 counties that are on the state's COVID-19 watch list. This includes Orange County. The affected industries include the indoor restaurants, indoor wineries and tasting rooms, indoor family entertainment centers, indoor movie theaters, indoor museums and zoos, indoor card rooms, and both indoor and outdoor bars, superseding Orange County's bar closure. The state closures are in effect for a minimum of 3 weeks and are subject to an extension by the state. Because of this sudden order, these businesses will lose so much, and this will likely have larger negative consequences on the California economy than we predicted. Additionally, the cities of Seal Beach, Huntington Beach, Newport Beach, and Laguna Beach closed their city beaches for the weekend. According to our state beach plan, the county-run beaches will be also have to be closed because they are next to the city beaches. Yesterday, I hosted a roundtable discussion with Orange County Hospital executives to hear their experiences on the front lines of COVID-19. The hospital executives shared the importance of returning to regular procedures for residents in need of medical care, about their surge preparations, as well as their need for more personal protection equipment, testing supplies, and support as hospitalizations rise and they begin to prepare for flu season. One executive mentioned the positive result they've been from an experimental drug called remdesivir as a treatment, and another said they are seeing fewer intubations and less use of ventilators as they learn and improve their response. This is some promising news. We will continue to work together with the hospitals and our healthcare agency staff to ensure our frontline medical professionals have what they need to treat patients. We also had a robust discussion about data and will continue to work together to release more detailed and consistent and accurate information on COVID-19 hospitalizations, such as how many positive patients are hospitalized because COVID-19 as opposed to other illness. As policymaker, we need to have the most accurate data possible when making decisions and providing transparent information to the public. These ongoing discussions with hospitals will help us to do that. It was reported in the media today that Orange County Healthcare Agency had reported the result of antibody tests together with the COVID-19 test result that we use to determine positive cases. The Board of Supervisors was not informed of this until we saw it in the press today. I immediately asked Dr. Chow to provide an explanation of what happened and how it affects our numbers. I've asked Dr. Chow to provide a timeline today of when the healthcare agency discovered they were receiving commingled test results from the state and when the county corrected it in our data. I have also asked Dr. Chow to begin reporting antibody testing separately on our website so that all the data will be clear and trackable to us and to public. Next, I will go over today's COVID-19 numbers, and then I will address specifically what those numbers mean in terms of where we are as a county. The Orange County Healthcare Agency received 652 new cases of COVID-19 and 9 new deaths. Of these, 4 are from skilled nursing facilities, 1 from assisted living facilities, and 4 were non-facility. This brings our total to 15,065 confirmed cases of COVID-19 and 354 deaths to date. 7,001 tests were reported today countywide, bringing our total number of those tested to 248,028 altogether. You can find more information on where testing may be found on HCA's website at ochealthinfo.com/COVID-test. Here you can find over 50 locations countywide that conduct testing. We have seen a steady increase in our trend of COVID-19 in Orange County over the past few weeks. The majority of these increases are in skilled nursing facilities, which are 51% of our COVID-19 related deaths as of today. We must continue to work closely with our most vulnerable populations, but I am confident that because we have some of the most well-equipped, trained, and experienced medical professionals here in Orange County, that these populations are receiving the best care available. As of today, we have 556 hospitalizations and 193 in ICU. So what do these numbers mean? One thing to note is that these daily numbers do not indicate that the cases and deaths reported on a given day occurred all on that day. These numbers occur over a period of days and sometimes weeks and are reported once test results come back. We want to deliver to our community accurate information about where Orange County stands when it comes to our coronavirus numbers and what these numbers mean compared to our surrounding region. As required by the state, the testing positivity over the 7-day average with a 7-day lag stands at 10.4%. In terms of hospitalization, our percentage change in 3-day average COVID hospitalized patients stands at 9%, below the 10% threshold. Our percentage of currently available ICU beds stands at 38.2%. That is well above the 20% minimum requirement set by the state. Orange County also has 64.6% of ventilators currently available. That is well above the 25% minimum requirement set by the state. As of today, Orange County has 7,862 estimated recoveries, or 52% of total confirmed cases to date have recovered. Some people are asking for 14-day average per million trends of hospitalization and deaths. As of June 29th, Orange County is ranked 4th for hospitalization at a rate of 127.2. This is in comparison to Los Angeles County at 155.7, San Bernardino County at 138.7, Riverside at 129.9, and San Diego at 96.1. Orange County is ranked 2nd for ICU patients at rate of 48.7. This is in comparison to Los Angeles County at 41.8, San Bernardino County at 48.8, Riverside at 36.9, and San Diego at 43.3. Orange County is ranked 2nd in average COVID-19 deaths per million over the past 2 weeks at 33.8. This is in comparison to Los Angeles County at 39.0, San Bernardino at 9.6, Riverside at 22.9, and San Diego at 12.2. This is not a metric required for the state or county tracking. Since our numbers are growing, I ask the residents and visitors of Orange County to please wear a face masks when you are in a public place and unable to properly social distance, as well as following hygiene and social distancing guidance. This is the utmost importance to stop the spread of the virus. We must also remember that we must protect public health while allowing people to go to work safely and responsibly so they can pay their bills and feed their families. We don't have to sacrifice public health for the economy or vice versa when we can focus on ensuring both are protected. Today, I'm joined by the Director of the Orange County Healthcare Agency and Acting Public Health Officer, Dr. Clayton Chow. Again, I appreciate you all joining us today and welcome Dr. Chow up to the podium at this time.
Thank you, Chairwoman Steele. Good afternoon, everyone. I'm Dr. Clayton Chow, Orange County Healthcare Agency Director and Acting County Health Officer. I would like to start today by addressing the state's action yesterday to close some industries here in Orange County due to increasing rates of COVID-19. Effective as of yesterday, the following sectors are closed in Orange County: indoor dine-in restaurants, indoor wineries and testing rooms, indoor family entertainment centers, indoor movie theaters, indoor zoos and museums, indoor and outdoor bars and pubs. These sectors are permitted to provide services outside or by pickup, with the exception of brew pubs, breweries, bars, and pubs, which must close both indoors and outdoor. And I want to further clarify that if you have a restaurant and you have outdoor patio, you can still serve people outdoor, but you're not allowed to serve indoor. These sector closures will apply for a minimum of 3 weeks and may be extended by the state depending on our epidemiological indicators. While the state has not indicated what metrics they will use when deciding to either extend the closures or reopen these sectors, we continue to actively monitor elevated disease transmissions via case rate and testing positivity percentage, increased hospitalization via the percentage change in a 3-day average of COVID positive patients, and limited hospital capacity via ICU and ventilator availability here at the local level, as does the state for all California counties. Now I would like to pivot to a subject I know our reporters have been asking about this morning: news that serology test results was mistakenly included in the daily case count updates provided to the public on our website. In short, on April 28, CowReady, the state's reporting system, added COVID serology tests as auto-processed tests. My team captured these test results as part of their all COVID test report, an error that leadership became aware of around June 3rd. At the time, several changes to data reporting were in process, including changes to reporting of test numbers. The removal of serology tests was formally implemented on June 26, when we released the new website. But the serology positive result was never included in the daily case count moving forward since June 3rd when we found out. So our case definition stated that only PCR testing can be used to confirm a COVID-19 result. but they were included in the total accumulated number of tests reported on our website until late June when we released the new version. I would like to sincerely apologize for any confusions on this matter that has caused for the community. In the future, I and my team will ensure that we will continue to do a better job to be more transparent with respect to the data that informs policy and personal health decision on our residents. So with that, thank you. I would like to invite my boss, CEO Frank Kim, to the podium.
Good afternoon. I'm Frank Kim. I'm the County Executive Officer for the County of Orange. And now we'll pause for questions from the media. Moderator, do we have any questions?
Yes, sir. First, we'll go to the line of Nick Gerda with Voice of OC. Your line is open.
Hi, everyone. Thank you for taking questions. I had two areas of questions. First, we're seeing the hospitalizations in Orange County now rise faster than at any other point in the pandemic. ICU rates in OC now higher than LA County. Dr. Chow, I wanted to ask, what does it mean for Orange County and hospitals if this continues trending in the way it is currently, and what do you call on the public to do to help slow the virus's spread? And then secondly, on enforcement, I know back in March and April, the county had an enforcement process for businesses that were not closed despite closure orders or following those procedures. Involved a lot of verbal warnings and education first before escalating to written warnings and actual closures by the county. And curious kind of where that stands now, if that kind of enforcement matrix is in place going forward, and if not, then why not?
Let me answer the second question, and then I'll bring Dr. Chow up to answer your first question. In terms of enforcement, I believe you're referring to our environmental health inspectors who do restaurant inspections. So those employees, absolutely, at this time, if we see violations of any of our protocols that we're responsible for regulating, we will take appropriate enforcement action. I think early on in this process, there was quite a bit of education, but obviously we've been several months now into COVID, and we've had a number of discussions with industry groups, with Orange County Business Council, et cetera. And at this time, we are following our normal protocol in terms of education and enforcement. So with that, I'll bring Dr. Chow up to address the epidemiological questions on hospitals.
Hi, Nick. Good afternoon, Nick. Thank you for your questions. I'm glad you asked that question. As you've noticed, that our number of hospitalization increased this last week or so, particularly this last week. And in our conversation with the hospital yesterday, one of the concerning things that we were informed that the number of people who are hospitalized seem to be younger in age. And if you look at our data, clearly the number of people who are infected in that age group from 18 to 18 to 30 or so, that age group is increasing as well. And so the hospital said young people infected, but they are not immune from getting worsening condition, and they come into the hospital, but it appears that they are recovering much quicker than the elderly population that as we have seen. As far as the number of bed, what we are concerned, at least for me, in my mind, what is concerning is if our ICU capacity dropped. And as Chairwoman still gave you the number earlier, we're still at 38% for the number of ICU bed available. And in terms of the ventilator, it's about 60-some percent. It means that the number of folks who are hospitalized in the ICU, the percentage of folks who needing a ventilator is probably about 50% or so. So we're pretty good. But you're right. I mean, if the numbers going up, it means that we really need to do more to prevent people from getting infected. And you know, it's correlate with the number of people who go into the hospital. Let me finish the bed issue. In terms of search, our capacity of search is still very good. So let me address what we could do. I mean, this seriously means that as a community, we really have to pay serious attention to the alternative prevention behavior that we need to do, and that is, I'll go back to it and you hear me say it over and over again, physical distancing of 6 feet away from people who do not live in the same household with you. Wear a face mask when you are inside or outside where you're not able to keep that distance. Wash your hand frequently, at least 20 seconds each time. And really, for our citizens who are at a higher risk, those are vulnerable, our senior resident, people with multiple health conditions, please stay home because the infection is in the community. It is here still, right? And so if you need to go out, including people who are healthy, if you need to go out for essential needs, go home as soon as you finish that. So there's reason, and you probably saw on the website, governor's website, on why he closed down the indoor venues of all of this sector, is that when you are an indoor and you linger around longer with people who do not live in the same household with you, you are at higher risk of getting the infection, right? And so I know the holidays coming up. I encourage every one of us, if you don't need to go out, don't go out. You can have a party with the people you live with, not with your neighbors, with family don't live with you. You can have a party at home. My nephew asked me, well, are we going to celebrate July 4th? And I said, yes, we're going to celebrate through Skype. So you stay at your house and I stay at my house, and we'll have a barbecue and we have a party together. But in all seriousness, folks, the infection is still in the community. So please do not go out as much as you can. And when you're out, stay 6 feet away from people who do not live in your same household. Wear a face covering unless you are the exception or exemption population, and wash your hand frequently. Okay. Thank you for that question, Nick, because giving an opportunity to keep reminding our community that very fact. So thank you.
Moderator, do we have another question from the media?
One moment.
Moderator, do we have another question?
Just one moment.
Thank you.
Welcome. Okay, the next question is from Hermela Aragawi from CBS Los Angeles. Do you hear us?
Hi, yes, I do. Thank you so much.
You're
I
welcome.
just have a few clarification questions for Dr. Chow to the issue of the serology test. So you said on June 3rd, administrators became aware that serology tests were being added to the total. At that point, is it accurate to say about 30,000 had been added to the total? And the second part of that is, did at that point serology tests stop being added, or did they continue being added until June 26th?
Thank you for that question. Actually, you get the answer to your question, and that is true. On June 3rd, when we found out that serology tests were added in the Cal Ready section, we stopped immediately. And so moving forward from June 3rd until recently, none of the serology was included. And by the way, the positivity rate has always been downloaded from Cal Ready. And so we know that at the state, when we had this conversation with the state, and the state said when they calculate the positivity rate, they take out the serology as well. So thank you for that question.
Sure. Just one more follow-up to that.
Yes,
so
ma'am.
it looks like June 25th, there was about 232,000 cases, and then the 30,000 looks like it dropped off on Friday, June 26th, right?
Right.
So I guess during these press conferences, and I'm sorry that I don't know, but did you mention positivity rates anyway? Was that something that was explicitly mentioned during your weekly conferences?
So we started to talk about positivity rate because when it got onto the state monitoring, remember right before June 12th. That's when state issue the monitoring criteria for reopening, and that's when the state started to talk about positivity rate. But we have always been downloading the positivity rate directly from the state system. I hope that makes sense.
Yes, and so you're saying the state was somehow never looking at the 30,000 that was added to the county data?
No, the state,
30,000 serology tests.
the state realized, the state know that the state add the serology to the PCR, but when the state calculate the positivity rate, the state never included the serology test.
Interesting. How did they know not to do that, but then it was included in the total?
Because the state know that serology test has no meaning, and so they have to include it because that's how the lab reported into CalReady. So it's the lab reported into CalReady, right? But the state know that serology has no meaning, and so the calculation was not included in the positivity rate.
Okay. All right. Thank you so much.
Thank you.
Okay, and the next question is from Matt Leslie from the Fullerton Observer. Please go ahead.
Good afternoon, everyone. Yesterday, the healthcare agency sent out a press release in the morning that was superseded by a state one the same day, and then again by another county one that reflected the governor's activities that superseded their earlier one. Was the county health leadership not aware that Governor Newsom was going to close the theaters, the dining in at restaurants, museums, and other businesses before his press conference yesterday?
Thank you for that question. From a county perspective, we're not always aware of the planned actions by the state, and there are times that we are provided some advance information, but oftentimes they've asked us to embargo that data because oftentimes they're in discussions with county health officers as a group, trying to identify what is the most appropriate action. So from the time that we have discussions with the state to the time that the governor makes his final decision, sometimes things can change. So we're not always provided that information in advance. So for us, we react to whatever is the official decision of the state. We had made our own decisions. We began our discussions about closing bars on Monday of this week once we got put onto the state monitoring list. We knew that our trend was not positive. We did not want to wait for the state to make a recommendation for Orange County to close bars. So once we saw that, obviously we had a holiday weekend coming up and bars were closed by the state in Los Angeles, and Riverside and San Bernardino had made that decision. It became very clear to us that it was appropriate action, particularly on Tuesday when we saw we had a large number of positive tests. So we made that decision, issued our health order around 10 o'clock on Wednesday. At that time, we weren't sure exactly what the state was going to do.
And was just a quick follow-up, was the initial bar closure by the county done because it was thought that people from neighboring counties where bars were closed might flood into Orange County to overcrowd the bars?
I think there are a number of considerations. I think number one, obviously, we were expecting, based on our trend, that we would be 3 days on the monitoring list. And then my understanding is on day 4 that the state then makes a recommendation for you to close bars voluntarily. So we wanted to get ahead of that, obviously. Number two, we were heading into a holiday weekend where we had concerns about large crowds, particularly with bars closed in our neighboring counties. And San Diego, I believe on Tuesday, had made a decision to close their bars as well. So absolutely, there was a portion of our decision making that was driven by the fact that if all of our neighboring counties closed their beaches and bars, that we could be overrun and have difficulty in enforcing the social distancing, as well as making sure that our community and the employees who work in our community remain safe.
Thank you.
Next question, please.
And the next question is from Paul Anderson from City News Service. Please go ahead.
I just want to clarify that the the mix-up or the gaffe with the reporting of the serology tests, or mixing them up with the PCR tests, that didn't have any impact on your attestation with the state for reopening businesses, correct?
No, because when we did our attestation, it was absent any of the serology data. We made that attestation based on the PCR tests.
And what do you say to the community, some people who might say or have doubts or be skeptical now of, some of the data that you guys are presenting or releasing because of issues like this?
Well, I think that it's a very straightforward message to our community, which is when we discover these issues within our data reporting, we're the ones that brought them forward. I think the county has always been very transparent, and when there are mistakes made or reporting inaccuracies such as that, we've always come out forward and we've shared them with you. So I see us as being a very transparent organization. We're here every week taking questions from the media, and I don't think that we've shied away when we've had input in terms of the kind of data that you wanted to see on our website that was incorporated into our refresh. And there are times when we have made mistakes, and we've owned up to those. So I see this as a process where we're being very transparent with our community, sharing with you that errors were made, and I believe we had those discussions with many members of the media even up to 2 weeks ago.
Thank you.
Next question, please.
Next question is from Leland Connolly from Orange County Register. Please go ahead.
Hi, how's it going? I'm covering the ongoing beach closures that we've seen this week, and wanted to ask a couple questions. We saw Newsom today during his speech acknowledge Orange County for its closures, but not actually closing down the state beaches in Orange County, just the parking lots. Were you guys surprised by that? It's almost a flip of what we saw a few months ago. And also wondering if there's been any evidence of coronavirus transmission at the beach. I know Orange County was adamant a few months ago about keeping their outdoor spaces open.
Thank you for that question. I think that having access to outdoor recreational opportunities is really important in Orange County. Absolutely, we have a large portion of our community that is working from home, and being able to go outdoors, enjoy the sunshine, recreate, we think that's wonderful, not only for your physical well-being, but also your mental health. And that is a serious, serious issue. I think the reason why we are closing for this weekend only is that with Ventura closing, Los Angeles closing their beaches, we were very, very concerned that we would be overwhelmed, and we wanted to do a good job and be a good partner within our community of keeping our residents and community members very safe. So then, as Laguna Beach made a decision to close their beaches this weekend and other large cities began to take their action, it was important that we aligned with them as well. So I can assure you that over the last several days, that the county and all of the cities along the coast that operate beaches, we've been having those conversations. And let me also share that we've had those same conversations with the state parks, and our understanding is that the state has not made a final decision in terms of their beach closure activities. And in a discussion that I've had several times over the last 2 days with staff at the state parks, at least my understanding is that they are planning to model and align their beach operations consistent with the neighboring cities. So while they haven't made a final decision or announced that at this time, my expectation is that we will see the states operate their beaches similar to what is happening within their neighboring cities and county beaches.
All right. And going back to the second question there, has there actually been any evidence of coronavirus transmission at the beach while outdoors, or is this just the crowd mentality that you guys based this decision on?
Well, I think number one, anytime that you have large groups of individuals that are in close proximity, if they're not able to maintain social distancing, that there is a risk. We believe that that risk obviously is much lower in outdoor settings. But obviously with 4th of July weekend coming up in Los Angeles, which is about 12 million individuals, closing their beaches, it is a concern, and that definitely was a part of the decision making. In terms of what we're seeing in contact tracing, et cetera, we've had a number of questions about beach exposure as well as exposure from protests, et cetera. Those things don't often come up as far as our discussions when we contact trace, because individuals are in so many different areas of the county that singling that out into one particular afternoon that you may have been at the beach, it's hard to know that that was a contributor to individual acquiring corona versus them being at work, them being at a grocery store, or transacting other essential businesses and activities. So it's hard for us to triangulate it to that type of data. I mean, we don't have individuals that have gone nowhere else other than just to a beach on one afternoon. I think if we had those kinds of instances, we would be able to report that, but we don't have that type of data. Next question.
And then have you talked to
go ahead.
Have you talked to the sheriff and the lifeguards about their enforcement plan? I know last time this came down, the sheriff was hesitant to actually enforce active recreation and closures.
Sure.
Have you been in contact with them about their plan and how they're going to keep people off the beaches who show up anyway?
Yes. So thank you for that question. So I know all of the cities are coordinating with their local police department and their park staff in terms of managing the parking lots. I think what's different here is that obviously most cities are closing their parking lots as well as the beach on Saturday. Some are optional on Friday and on Sunday. In terms of the county beaches, we will have gates down across our parking, and obviously we're coordinating with law enforcement for any enforcement that might be necessary. So those conversations are happening.
And next, we'll open the line of Margaret Carrero with KNX. Your line is open.
Thank you again for taking questions. A little bit more clarification on the beaches, if I may. Not accurate to say all beaches in Orange County closed this weekend, right? Because some are state-owned. Where do we stand with San Clemente and Dana Point, if you know? And I have another question for Dr. Chow, if I have a moment after.
Sure. So my understanding is that San Clemente has not taken formal action at this time. So their current operating plan is to remain open this weekend. Dana Point has a very small beach within the harbor, but the large beach within Dana Point, Doheny, is a state beach. So that will be determined by the state of California in terms of how they manage that operations.
Okay, and a quick question for Dr. Chow with regard to, you had mentioned that more younger people are being hospitalized. Do we have a time frame of when that started to increase with younger people? You said between, I think, 18 and 30 or so?
Hi, Margaret. Thank you for your questions. And so this is the information that we got with the Hospital Association yesterday. And so I have every intention to work very closely with them now and get some more information from them in terms of the details. So more to come, okay? They did say that just recently, this last week or so, there are young people get admitted to the hospital. Thanks, Margaret.
And do we know what the status is? I think you said they were recovering a lot faster, but I mean, how badly are they? How sick are they getting?
I'm just informed yesterday that the length of stay in the hospital for the youngster are shorter. So, like I said, I will get more detail from them and we'll share.
Thank you.
Thank you, Margaret.
And next, we'll open the line of Amy Paxton with the Associated Press. Your line is open.
Oh, thank you very much. Yeah, I had a question for Chairwoman Steele, if she is still there. I just wanted to see if she could comment on the governor's decision to close businesses this week in terms of what we're seeing in terms of the rising cases and hospitalizations, and especially after the holiday weekend.
So Chairwoman Steele is not available at this time.
And next, we'll go to the line of John Earl with Surf City Voice. Your line is open.
Yeah, thank you very much for taking questions. I want to get back to the issue of enforcement for a minute, if I could. And I had hoped to get a response from the chairman of the board. on that issue as well. But and I'm wondering why she doesn't ever stick around for the questions. But regarding enforcement, I did a survey of hundreds of businesses in the downtown Honey Beach area, and found, and before the June 18th face covering order by the governor, and after, including just since the new order by the government, by the governor. And I found rampant violations of documentation, of enforcement, and even employees having to wear masks and so on. And employees who were afraid to speak up or make a complaint because of the fact that they might get fired. They were told by their employers, we are not going to enforce this rule for guests at the hotels and so on. And so I decided to test the complaint process. I called my city. No enforcement mechanism was there. None through the police department. Called them to. Called the county, Michelle Steele's office. And they took, an office person took my complaint and said I could follow up with Dr. Chow's office to make sure it was, so I could give them the proper information and so on. I did that, left a call, no response. That was more than a week ago. Doesn't the county, after 3 months, shouldn't you have an enforcement mechanism in place for situations like this? And what happened to my complaint? And what are you going to do? And actually, do you take responsibility in part for the spike that's occurred because of the lack of enforcement? Thank you.
Thank you for that question, and I think we can follow up with you afterwards to hear more about your specific issue. As you can imagine, leaving a voicemail or trying to work through Dr. Chow at this time can be a challenge. Obviously, the hours in the day are short, and there is quite a lot to do. In terms of enforcement,
with all due respect, I just want to interject. The challenge was to find an enforcement protocol at any level of government in this county. That was the problem.
I understand. So absolutely that there is a role for the county in terms of enforcement, whether it's from a law enforcement perspective, although I can't speak on behalf of the sheriff. But remember, also, the sheriff is only law enforcement for a portion of the county. Local cities also have their local health orders, and they have regulations, et cetera. The county, we are regulated or licensed by the state if you're referring to our restaurant environmental health inspectors. So generally, their authority rests with food safety. There is a question about the authority of my environmental health inspectors to do enforcement related to business guidelines, which aren't related to food safety. So there are a number of questions, and my understanding is that is a discussion that is happening not only amongst my other county peers, but also with the state. So I don't know that I can give you a black and white answer as to whether every city will enforce state industry guidelines with their local police department. But that is an area where I think the governor has identified that there have been some shortcomings, not just in Orange County, but in all counties. And he is working on his task force to provide that additional support and clarity. And I think that's something that would be helpful to us as well. Next question, please.
And next, we'll open the line of Christine Kim with NBCLA. Your line is open.
Hi, good afternoon. Thank you so much for your time. I have a couple of questions here. Can you elaborate in terms of the testing number errors, how the error was first discovered, and then also on those lines, is the county still reporting the total tests performed and not how many individuals were tested?
Hi, thank you for your question. So let me repeat about the serology test. As I said earlier, the state reporting system added serology into the system. And on May, let me look at that, on May 20, April 28, and we found out that the state, because we download the results from the state system called CountReady, so we found out on June 3rd immediately we separate out the serology and did not include it in our accumulative moving forward. But the test that was included was still in the total, and then when we switch over to the new version, we took those out. So just want to make very clear that we did not include the serology from June 3rd until now. I know I get this question all the time. Why don't we report individual? We are downloading stuff from the state, and we just don't scrub out the individual because every test, whether or not you get test negative today, it doesn't mean that you're negative tomorrow. So individual test is very important. So thank you for your question.
Let me ask one other question. In terms, if you could clarify, I'm not sure if I heard this right, but the percent of hospitalizations in Orange County currently are higher than in LA County. Is that what you said?
That was the information that we gave you. Yes.
Thank you.
Thank you.
Fry with Los Angeles Times. Your line is open.
Hi, good afternoon. Thank you for the opportunity to ask a question. Given that county leadership was made aware of the issue with serology tests being included on June 3rd, can someone explain why it took several weeks for the county to correct that information on the website?
Thank you for that question. In all honesty, I think that was June 3rd, and we were getting ready to release our website within less than a week at that time. And then we got caught up with the reopenings of different sectors, and then there's glitches with the new system, and so it wasn't ready until June 26 when we move it out. But you're right. I mean, we stopped adding the serology to it, but we didn't pull out from the total of accumulation into June 26. But I can assure you that in terms of the positivity rate, it was always downloaded from the state, and we did not self-calculate it, so the number would be still the same. It would not have affected the decision making that we would have made. Thank you. I have to stay here. Next question, please.
And ladies and gentlemen, as a reminder, if you'd like to ask a question and you have not already queued up, please press 1 then 0. Next, we'll go to the line of Spencer Custovio with the Voice of OC. Your line is open.
Hi, thanks for taking our question. This one kind of relates to the state task force that Newsom is coming down. I was wondering if, the HCA staff, the county staff has had a chance to meet with some of the numerous regulatory agencies coming in. So you can have ABC, the Alcoholic Control, OSHA, it's coming in, the Department of Consumer Affairs, the Department of Business Oversight, to help with what Frank was talking about earlier, where a business may not fall under like a food licensing or something from HCA, but on the other hand, one of these agencies can handle that. So I was wondering if, any county officials have met with these, strike teams is what the governor is calling them, and how enforcement would be rolled out from there.
Right. So thank you for that question, Spencer. I not officially met any one of those folks from the strike team, and I'm looking at my boss. I don't believe any of our officials have met with the strike team member yet. So we'll let you know if we have a conversation with them. Thanks, Spencer. And one more question, please, operator.
We have a follow-up question from the line of Hermela Argoui with CBS Los Angeles. Your line is open.
Hi, yes, thank you so much. I hate to belabor this point, as something just kind of stuck out to me. Dr. Chow, as you said, that health leaders became aware of the 30,000 June 3rd. I understand that. I know it was corrected on the 26th. Supervisor Steele, you said you didn't know about the serology test error until it became public in the media today, and that just sort of stuck out to me as a little bit.
Uh-oh, you got cut off a minute. So I own up to it. It's probably my fault that I didn't inform the board. So because it was not calculated into our number, I didn't think that it would be that significant. But I learned, right? So
I see. But what about when that number got corrected on June 26th? At that point, were officials made aware, or did they notice that the number dropped as opposed to rose, the number of tests?
That you have to ask. Frank.
No, in fact, when we had the meeting with members of the media when we were rolling out our new website, we also informed them at that time that we were revising the historical data to pull out the serology numbers. So that was discussed at that time, and then we had other discussions with other members of the media even prior to that as well. So for us, when we became aware, we did start having those conversations so that people were aware that we intended to correct it with the new website update.
Was that June 26th or before?
Oh, it was before June 26th.
Okay, so did the Board of Supervisors know by that point?
I'm not aware that I had an individual discussions with them. So that communication did not occur from my office, and obviously that's a mistake that I've made because I was aware of it. I should have informed the board.
Okay, thank you so much for your time.
Okay. If there's no other questions, I want to thank everyone for their time. Thank you, and we'll see you next week.